The Kerala model and the Italian model. What lesson we learned? 3rd of March 2020 was a great day of relief and joy in the midst of all this lockdown time for all the people in India. It was the day when a 93-year-old grandpa and an 88-year-old grandma has been cleared free of coronavirus and discharged from the hospital. Everyone is still applauding the commendable work done by the healthcare workers, including doctors, nurses and other medical staff, along with the government and its machinery. This video is not created to show the comparison between strategies taken by Kerala, a state in India, and Italy in fighting coronavirus and its effectiveness. It is created to make a point that the Kerala model needs to be considered and discussed in detail to encourage the public all over the world to follow the strict measures put down by the authorities. Kerala, the tiny state in the south of India, registered its first coronavirus case on the 30th of January. While the first coronavirus case in Italy has been reported on the 21st of February in 2 people who were reported to have traveled from Wuhan. Since then and until this moment in time, these 2 places have fared completely differently. Just for all your information, Kerala has a population of 34.8 million and a population density of 860 persons per square kilometer, while Italy has a population of 60.48 million and a population density of 206 persons per square kilometer. The difference in approach to this pandemic taken by both these places has been completely different. Italy seemed to take this virus lightly, at least in the initial days of its spread. While Kerala, well, it is not a good thing to say, but thanks to the lessons learned from the past Nipah virus time, Kerala was ready and prepared enough to fight head-on with the coronavirus, of course within its limitations. From the first case itself, the government was well prepared, along with the civil service machinery, healthcare workers and all relevant services. They had a plan in place. They followed exactly what WHO has asked to. They put the infected in isolation and did all contact tracing and needed measures. People from Kerala has a unique characteristic. At times of need, like the recent flood and Nipah times, they forget everything else. They keep aside everything else, including any political, religious or any other internal issues, and they will unite in every way possible to fight and combat the issues. They indeed find pride in that. With the help of the central ministry, the Kerala machinery worked smoothly like a well-oiled machine. Kerala's strategy was apparent. They wanted to contain the virus as effective as possible. They knew that if it gets out of hand, then the outcome would be disastrous in a country like India, with its 1.3 billion population and high population density. They knew for a fact that, considering their population, the healthcare facilities would be insufficient had this virus spread gone out of hand. So they acted accordingly. Kerala, with all its limitations in terms of the testing facilities and so on, still fared well, and the statistics is in front of everyone to see. Kerala as of now has a total coronavirus case of 315 infected cases. To compare the different strategies, we can find that the strategy taken by a nearby state was a different one. While Kerala acted swiftly to contain the virus spread, the nearby state took a delay and mitigation strategy. Their first coronavirus case has been reported only on the first week of March, but they have now nearly 500 cases by now, when Kerala has only about 315. When we say this, we know that it's still early days. One cannot say and conclude that Kerala contained the virus adequately. It could still go out of hand if the measures in place are not continued and strictly followed. However, many doubt the lesser number of cases in India and Kerala and relates them to the lesser number of tests being conducted. However, at least for Kerala, it is a fact and relief that no new untraceable cases are appearing from outside of the identified cluster regions. Time will only tell what was right and what was wrong. At least for the time being, the Kerala model has been proven the right one. They say they would continue their efforts to learn from this coronavirus pandemic and say they are prepared to adapt and evolve to combat this deadly virus, of course with the help of the central ministry and with the collective efforts by one and all in Kerala. Indeed, the people in Kerala also need to be appreciated for their full cooperation with the restrictions put down by the authorities. 99.95% of the people in Kerala followed all the rules and stayed at home. The number one corona cases seen now in Kerala is created by a mere 0.5% of people who did not care about these rules. This itself shows the importance of staying at home and staying isolated to fight this virus. Being a highly populated region and with medical facilities that may not look sophisticated and aesthetic to many, Kerala public healthcare system has proven again how useful public healthcare systems can be to the common man. The stand taken by the Indian government to make corona testing and treatment free is also highly commendable in this time of great concern. The Kerala model also signifies the need to help, support and strengthen the public healthcare system in the country. Yes, India and Kerala may have a slight advantage in terms of the weather in controlling the spread of this virus. The current data suggests the temperature might have a slight effect at least on limiting the community transmission. But only time and extensive research data will tell if this is true or not. Finally, we know for a fact that this lockdown is a double-edged sword. One side is the fight against coronavirus by locking down everything possible. The other side is the great concern on the economic freefall nations are experiencing. Surely, a good balance needs to be found and implemented sooner than later to sustain normal life of people without much economic, societal and psychological issues. Let us hope that the nations will collectively rise and find a plausible solution to these greater issues. Yes, Kerala model can be a good model. They were proactive, they had well thought out guidelines in place. Their government, civil service, healthcare and all relevant machineries acted collectively. Most of all, the cooperation from all the people in Kerala was the key in the fight against coronavirus. So please stay at home people and stay blessed. Thanks for watching.